Dr. Bo, I guess the number one question with dental implants is, how much is it? What's the cost?
Yeah.
So what goes into this cost? What affects the cost?
There's a lot of factors that go into the cost of this. So there's some docs that have their own implants made that are not FDA approved. Some of them order them from Israel. So there's lots of different types of implants. There's 80 different name brands of implants. There's zygomatic implants, pterygoid implants. There's just a lot of different implants you can use. You can use cheaper implants. You can use more expensive implants. So there's a lot of different options there. We use great implants, all FDA approved implants in our office. Then you can get into the materials of what the teeth on top are made out of.
Okay.
So you have acrylics, you have plastics, you have zirconia. Zirconia is the strongest typically used. So you're not going to worry about chipping your teeth, breaking your teeth when you're done with everything. So we've actually restored a bunch of previous arches done elsewhere that were done with the acrylics, like basically a denture just hooked to your implants that doesn't come in and out. And they always pop a tooth off here or there, and they're coming in, and once a year they're paying $300, $500 forever to have some doctor put that back together for them. So it's just an ongoing.
So zirconia is kind of the gold standard for the best material?
Yeah, it's one of the strongest. So yeah, it's kind of our gold standard in our office for sure, because it's so strong, it's so durable, it just holds up really, really well. The color on it holds up. It's a great outcome. And then there's other things. How many doctors are involved with your treatment? So if you see your doctor and they say, hey, go see this person for the implants, and then they're going to see this, then they're going to come back here, and then they're going to send it to some lab that's going to take a month to get the teeth back, and they're going to pay that lab that has to pay all their employees, pay all their owners, they're paying themselves, the surgeon's making their money. So you have all these different companies that all have to, I mean, it's just the way the world works. That company has to make a profit to pay its employees. Each company does. We have everything in-house. So,
you have your own lab.
Yeah, we have our own lab.
You called it a huge or gigantic lab.
Yeah, so we kind of went, kind of like what I do. I go all out on pretty much everything I do. I always want to be the best, so we could have bought 1 mil. We don't have 1 mil. We have over 4 mills.
Mill's the thing that makes the teeth.
Yeah, so the mill's the thing that has a bunch of little burrs in it, and it cuts out of like a hockey puck of porcelain. It cuts out the teeth out of that.
Is that right? Okay.
So we have it that cut porcelain. We have them that cut titanium. We have multiple 3D printers.
A printer, so the teeth are printed in some cases?
Yeah, so our temporary teeth with our full arch restorations are actually 3D printed right there in the office.
So this all affects cost?
Yeah,
whether
definitely.
you send it out to a lab or do it yourself?
Yeah. So with us, if a temporary was to break, we can just print you another one. So you could call us and say, hey, I had something happen. We can just make you another one. So before you even get to the office, we already have a new temporary waiting for you. You have one of the old school dentures that were converted, you break that, there is no way to just print another one. You have to patch that thing back together until your final teeth are made. And that could take an hour, it could take 4 hours. You may have to come back the next day. I mean, no one wants to do that.
Okay, so we know what the big guys are charging, and you're a little bit less.
Yeah.
And it's because you do it all right there,
Yeah,
and you're faster.
Yeah, typically we're a little quicker than the other guys because we have everything in-house.
It's like an unfair advantage.
A little bit. I mean, and I was once a new graduate out of dental school, new guy learning, but we've had years of doing this, and we've been able to kind of fine tune the way we do things and kind of build exactly what we want, so we can kind of specialize and do the things we want to do all in-house. When you're starting out, you do 1 or 2 of these every couple months, and you can't do that. You can't afford the investment.
Would you say there's less than 5% of dentists in America that haven't done this setup?
Yeah, I'd say there's definitely less than 5% of dentists that have their own full service lab in-house, and all the digital equipment. We're fully digital with our full mouth implant stuff, and it just takes out so much of the guesswork and just helps us have a lot smoother, better experience for the patient.
What if they took away your technology, your lab and everything?
Oh, no way.
I mean, could you do it? Would it be tough to go back to the old way?
I'd probably have to figure out how to retire early.
Is that right?
I mean, to go back.
It's that big of a difference.
I remember a couple years ago doing it the old school analog way, and there's no way. I'm a member of Full Arch Masters group.
Yeah.
And Ryan Dunlop has just been a godsend to myself and so many of my buddies that are doing this full digital. And it's amazing what the digital technology and going digital in the world of full arch dentistry is.
Okay.
It's just completely different, and the old school way of doing things, it works, but it's so much more time consuming, so much more expensive. We can cut out some of the parts that we don't need anymore.
Okay.
Some of those middle steps, we cut those out so we can have some cost savings passed on to the patient.
So the public, they don't know the difference.
No, I mean, if you went to this guy and he shows you before and after, and then I show you before and after, he can get good results. I can get good results, but it's the process of going from point A to point B that I think the digital approach with our in-house digital lab, that's going to be the game changer of, we want every patient to just have a great experience start to finish. We don't want you to have a good experience and then great at the end. We want it to be as great as possible all the way through.